This is Dr. Roger Knapp, pediatrician. I'd like to talk to you today about burning when they urinate. Children have discomfort when they urinate. It's called dysuria. And there's obviously it could be caused by infections, but 90% of the time it's caused by irritation, poor hygiene, or a lot of soaps and bubble baths, etc. can irritate that bottom labia area. A little more common in females than males. If they finally get potty trained past 2 years old and they don't wipe poorly, wrong direction, a lot of times you'll go in there and they not only didn't flush, but there's no paper in there. So that irritation will come and go, but it's an occasional burning when they urinate, but the next time not. Maybe every few days or every few weeks. And the concern is that infection? Almost never. The white cells in the urinalysis can be caused by irritation or infection. And so the true proof of an infection is culturing it for bacteria. And so don't assume that when the doctor runs a test and gets the report back within minutes and says there's an infection. That's only evidence of white cells and could be infection or irritation. So you really need to request a culture that comes back in a day or two. And that really proves is there bacteria in there. After 2 years of age, we recommend a less irritating soap. Bubble baths are notoriously bad for them, but also the baby soaps and ivory and milder baby soaps, they can also irritate by removing the lining of the mucus off those surfaces. So I actually recommend a milder cream soap like Dove, Oil of Olay, milder cream soap. Unscented, no fragrance, the bar soaps that we use. Then what you do is if they get irritated, you can put a little bit of Vaseline or A&D ointment in the labias and down the bottoms, and that'll really soothe it. Some of the kids get irritated every several times a week. It's frequent, and so there, after every bath, just put a little bit of thin coating of ointment down there. It's just they don't take care of the area. There's another condition, however, called asymptomatic bacteriuria, and that's where bacteria live in the intestine, the bladder, and it's in the bladder all year. Doesn't do any harm. It can cause harm if you have catheters and defects of the kidneys and bladder, but in a normal healthy kid, it's not an issue. But the child will have irritation. The doctor runs a culture, comes out positive, and that may not have anything to do with that. It could have been in there all year. It doesn't hurt to take the antibiotics for the asymptomatic bacteriuria, but you may find that it doesn't help the symptoms because it wasn't the infection. They're frequently irritated. We just happen to find the bacteria. It's actually similar comparison to strep throats. Kids can have a sore throat from allergy or drainage, and what they do is they go see their doctor, and they're not sick, ill acting, or fever, but the doctor runs a test and finds strep in their throat, and they're maybe carriers of strep, and it's been in there all year and had nothing to do with the sore throat. But they assume that, hey, you got strep throat, but there's no fever or ill acting behavior. That's probably not strep throat. It's just a sore throat with the strep in there and had nothing to do with the illness. Again, not harmful to treat it, just overuse of antibiotics. So it gets real confusing as to when we culture bacteria out of the urine, is that really causing the symptoms or not? If it's infrequent burning, the bacteria are not related to that, it's just irritated. And if we take better hygiene care of the bottoms, then we'll have less symptoms. That's kind of the lowdown on dysuria. Thank you. This is Dr. Roger Knapp.